Hello and thanks for joining us on this week's episode of Health Options. Health Options is the program that not only tracks government policies on health, but helps you with the right information you need to make informed choices about your health. Thanks for joining us on the program. I am Rabi Abdullah. Self-medication can be defined as the use of drugs to treat self-diagnosed disorders or symptoms. It could also be the intermittent or continued use of prescribed drug for chronic or recurrent disease or symptoms. In developing countries such as Nigeria, most illnesses are treated by self-medication. A major shortfall of self-medication is the lack of clinical evaluation of the condition by a trained medical professional, which could result in misdiagnosis or delay in appropriate treatment. A major problem of self-medication with antimicrobials is the emergence of resistance of human pathogens. Resistance to anti-malaria drugs has also been reported in many third world countries. Reasons for this resistance include the irrational use of anti-malaria, including indiscriminate non-prescription use. The adverse effects of self-medication cannot be overemphasized. That's our focus on this episode of Health Options. Aloe vera is a succulent plant that has many health benefits and has been used in alternative medicine for the treatment of many conditions and in beauty therapy. Be part of our Nature Scanner for our wonderful piece on aloe vera. Thanks for joining us on the program. If you're just joining us, this is Health Options, and we are taking a look at self-medication and the dangers inherent in it. To take us through the topic is Ifeanyi Ikebudu. He is the chairman of the FCT chapter of the Pharmaceutical Society of Nigeria. Welcome to Health Options, pharmacist.
Thank you so very much.
You mentioned what self-medication is all about in my intro, but I need you to just add a bit from your end as a pharmacist. When we, at the mention of self-medication, what comes to mind?
Thank you so much. Like you have said quite rightly in your intro, the self-medication is everything and all things that pertains to one taking medications without due recourse to a physician's prescription. Most often than not, in a country like ours, people tend to believe that because something has happened to somebody, if something similar happens to them, it might be exactly the same thing. We also have issues of what I may call oral tradition, where we pass information from person to person verbally, and such things tend to want to promote any action that people want to use to take care of their medical needs. So self-medication is everything that has to do with us taking medications for some perceived ailments, for some self-diagnosed ailments, without having a recourse to seeing the professional physician. It is also, like you have said in the intro, where we take medications for chronic ailments like diabetes, like hypertension, like asthma. There is need for the patient to periodically revisit the medical practitioner to review medication that have been prescribed. But often in our country, once a patient has seen a physician and the patient has been given, the patient continually goes to refill their prescription without having to review that ailment or the prescription from the medical doctor. That also forms part of self-medication.
Why would someone just embark on self-medication? What factors fuel that?
From the intro also, you did mention that self-medication is rampant in developing countries, and that is because of the policy implementation gap in the developing countries. One of the reasons why persons go into self-medication is because of the seeming quote unquote cost of medical consultation and the time. If you recall what happened 2 years back, especially during the peak of COVID, when somebody has the need to visit the medical facility, especially those who are feverish, they tended to be scared about going to visit such a facility, because the belief was that whenever I had any issue with the elevated temperature, you'll be considered a COVID patient. Now that stigma even before COVID has been there, people do not want to be seen as patients, as consulting medical doctors. And again, because of the dearth of facilities and disproportionate ratio of medical doctors and other healthcare providers to the population, there seems to be a very large time spent in getting consultation from medical facilities. So the need for them to quickly do what they want to do by trying to save, quote unquote, that time and that resources by not going to see the medical doctor tends to encourage patients from self-medicating. That is one. Also is the fact that in these days of internet, people tend to practically have information at their fingertips. So somebody has an itch, he picks up his phone and googles causes and treatment for an itch. And Google gives so many things. And the person now believes that whatever has been found in Google is the cure. However, when you go and see a physician, there are so many kinds of causes of itch that might not even require medical treatment. Now, because the person has Googled and seen something in Google, the person now uses that to go and purchase medications and start treating himself without minding the possible adverse reactions that might emanate. Another reason is medicines in this country are seen as articles of trade. In developed countries, you don't just go into a pharmacy to purchase medicines without a proper prescription, especially what you call the prescription-only medicines or the controlled medicines. However, in this country, you get medicines all. You turn any corner of Nigeria, you get a medicine shop, a pharmacy, people who work with pictures on their heads, even the buses. Yeah. So these medicines are freely available to persons, so they can easily freely get a medication.
When people Google the remedy for a certain ailment and they, embark on that and subsequently administer that, what are some of the consequences that could come from such?
The first thing could be an adverse drug reaction, which are untoward reactions that emanate from the use of a particular drug. Some of these or many of them are very well documented. The second part could be a drug-drug interaction. Now, when somebody Googles having established some of the symptoms the person feels, and Google gives an array of possible causes and possible treatment options, Google does not take into cognizance the fact that this person might be taking some other medications. You see, when you see a medical doctor, the doctor goes through your file, and through the file, he's able to know what the person's medication history is and know what kind of prescription to be given. And when the person comes to the pharmacist also looks at the person's medication history and know which particular medications could interfere with an already existing medication the person is on. But Google doesn't have this facility to do that. Okay. So there could be a drug-drug interaction between a drug being taken by the person and the new Google prescribed drug.
Okay, that's where it has to do with those who have access to the internet and all of that. Yeah. But for our brothers and sisters in the rural areas who probably don't even know anything about such technology, it's about Mr. A telling Mr. B that, why don't you try
the oral tradition?
The oral tradition, yes. Yeah. Why don't you use this particular one I used when I had so ailment? It could work for you, and off he goes. Yeah. Speak to that.
Well, that is also another danger because we are a very communal people in Africa, especially in Nigeria, and people who have stayed together for a particular period tend to easily assimilate what others have told them. Now, like I said earlier, because something happened to me sometime, and something similar, quote unquote, happens to somebody else, does not necessarily mean that those conditions are the same. Yeah. There are so many ailments that have aching symptoms, and those symptoms might not exactly fall into the diagnosis that will give you a clear-cut diagnosis for this particular ailment or the other.
And what could work for you might not even work for you.
Might not work for you. Yeah. So now let's do something like that. Let's say our two brothers now, the twin brothers of malaria and typhoid, which in most cases everybody say that they are conjoined twins. If you watch critically, some of the symptoms of malaria and typhoid are similar. They are similar. And when people, like we see in our practice areas, come, the first thing they tell that they have malaria and typhoid. You now ask, how do you know you have malaria and typhoid? And they said, I said it before now. You know, I said it before now. Have you run any examination? No. Have you seen a medical doctor? No. Now you keep on trying to educate them. And because of our policy here, most of them do not really want to. They think you are being oversabi, quote unquote, when you try to point out the right thing to do to them. We do not have the habit of completely exhausting our prescriptions.
Yeah,
we don't have that habit.
People don't adhere to dosage.
You have a prescription for 7 days, you use it for 2 days, you feel that you're okay, you drop the rest.
It really
depends. It depends on the kind of medication. If there are antibiotics, for example, there's this issue of antimicrobial resistance that could spring up. And that is what we are seeing now prevailing in anti-malarias. You see, if you watch through the years, we started with things like quinine, went to SPs, chloroquine and the rest. We now came to ACTs. Now the ACTs are failing, especially the artemether lumefantrine brand of ACTs are failing. So it's because of increasing resistance, which is attributable to the lack of adherence to the prescription of these medicines. If
a prescription for 1 week is given to someone, and as soon as he uses the medication and starts getting better after 2 days, he abandons it, shed more light on why that is really dangerous.
Microorganisms are living organisms, and once somebody gets infected by a microorganism, there's a gradual build-up of the population of microorganisms in the system. First of all, the body's self-defense mechanism comes into play, what we call in general terms an immunity. Where the immune level of the immunity of the person is not unable to tackle that infection, it now manifests as an ailment, as an illness. And the person goes and sees a physician. The physician conducts a couple of examinations on the person and determines this is the kind of infection the person has and gives a prescription for like 5 days, 7 days. The moment the person starts taking that antimicrobial medication, it starts knocking down the population of the bacterium
in the body,
or whether fungi or whatever it is in the system, and the person starts getting better, and the immune system also starts playing its part to help the recovery process. Now, because the population of the microorganisms has been brought down to a level where the person starts feeling better, the person now feels, I have recovered. Maybe if there was fever, the fever has abated, the headache has gone down, the joint pains have gone down because of other medication the doctor prescribed. The person now takes the other medications and throws away. Of course, because the way we are treated, like I said earlier, God gave us the ability for immunity. Our immune system now helps to give us recovery. However, that microorganism has not been completely exterminated from the system. So the organism now mutates and changes its pattern to be able to fight subsequent introduction of the antibiotics or antimicrobial in the system. By the time we now use that same antibiotics, like we have done before, maybe 2 days and drop, there will now be a gradual increase of resistance of that microorganism to that same antimicrobial that has been used, that's used to give us good effects. In the next couple of months, that same antibiotics might not give you the kind of effects. That's a big problem.
Okay.
That is why there is an increasing cost of medications.
Okay, and it's the same thing applies to anti-malaria
too.
Okay. Drug production is a long process, takes years.
Yes, and very expensive too.
Exactly, very expensive. So by the time resistance is developed, because I read somewhere that there's been so much resistance to antimicrobials and all of that, and of course, which means that the pharmaceutical world needs to start looking forward to coming up with new
continuous research and development of new moieties
into that. On that note, tell Nigerians the right thing to do and why they shouldn't do certain things to avoid the adverse effect that could come with self-medication.
The issue of adverse drug effects that could come. There's also the issue, like you just mentioned, of masking a particular ailment. because someone felt some symptoms and they believe that these are the reasons why the symptoms are. This is the possible diagnosis, which, because the person is not professionally informed, could be wrong. So one of the events or effects could be masking a much more serious ailment in the person. By the time the person is not treating the symptoms, because basically when the person is self-medicating, he or she is treating symptoms, there hasn't been a proper diagnosis. Yeah. So, and that now means that much more harmful events could occur. We have seen cases where some people died of hepatitis because they felt they were treating, they were having malaria, and they co-brought typhoid. Each time there was a fever, they took paracetamol or they took anti-malaria and antibiotics. The fever will abate. After a couple of days or weeks, it will relapse. Person comes down with fever again. He goes back and takes the medication. Meanwhile, there was a much more serious event in the person.
That is not being
that was
even
not
treated
even at all, not even being touched
at all. Yeah.
So by the time the person is finally diagnosed of hepatitis, it has gone to a very chronic level that the life might not be saved at that point. And that also goes to what we have pointed out to the use of herbal medications. The
herbal medicine.
Herbal medicines. Nigeria is blessed with a rich fauna of vegetation, and we know that these vegetations are very, very helpful to us. However, the issue is that because we have not been able to elucidate the properties in this fauna, the herbal medicines that we are using, especially from the uninformed, are not properly standardized. So, and there are so many wide claims on the remedies that could be gotten from herbal medicines. Now you can imagine that the herbal medicine will be treating ailments that are two different spectrum. I don't know how to. Herbal medicine could be treating, for instance, hypertension, at the same time hypertension. You now wonder what is the mechanism of action. It is treating hypoglycemia and hypoglycemia in the same medication because of lack of standardization of those medication. So those things help to mask the main ailment the person is having, which could lead to untimely death, aside from the cases of those adverse drug reactions or side effects.
The right thing for Nigerians to do is what?
When you feel sick, you go to see your medical practitioner, you get your diagnosis done, you fill your prescription in the pharmacy, and you stick to the prescription as the pharmacist would have counseled you.
We hope the Nigerians will learn to speak with their health professionals before indulging in the administration of any medication.
I want to also inform Nigerians that it's not everywhere you see medicines stocked and sold that you have pharmacists.
You are talking about registered premises now?
Yes. Okay. And the window through which people view the pharmacy is the community pharmacy practice. And that community pharmacy practice is those pharmacies that you see within your neighborhood where you can easily access the pharmacist. In that community, wherever you see the green sign, that green sign,
you see the RX.
RX is the neon sign. That is where you can access all the time, every time, quality pharmaceutical services. And I want to encourage Nigerians to always ensure that they visit pharmacies, registered pharmacies, to access their pharmaceutical services.
They should not patronize quacks, right?
At all. At all.
Thank you so much for coming on the program.
You're welcome.
Let's now go over to our nature scanner to bring you the health benefits of aloe vera and some risks associated with it.
Aloe vera is a very, very ancient plant. In the Indian Journal of Dermatology, the plant was referred to as immortal plant. It is a succulent plant. This is the leaf, and it's been found to be used in so many areas as food, as a flavoring agent, as herbal, in medicine, as an antioxidant, as a laxative, and in specific terms for the treatment of teeth and gum diseases. And its importance or its uses or effectiveness is equated with the paste, the normal toothpaste. So we can classify its uses like heartburn in GERD, which is gastrointestinal reflux diseases, where it helps in heartburn. It has been used to reduce sugar level. It has been used for skin, all kinds of skin issues, and effectively in coloring of lotions and creams. As laxative, you can extract the liquid safely and combine it maybe with corn, or you combine it directly with warm water and gargle with it. It's termed alternative mouthwash. And you need to be very careful because of the aloin, which is a very dangerous chemical found between the outer leaf and the joy stuff inside the leaf here. So it is important to be very, very careful. People can isolate the cream, the gel, and apply it locally in a very, very careful manner, mixed with Vaseline gel, because sometimes it can cause a lot of skin reactions. So you have to be sure your kind of skin would not react to it, so that the amount that can be mixed. All this will depend on expert advice. So even in using it for medical, you also have to work with your doctor so that you don't have or run into the not worse effect that it can cause. I also mentioned its effect on the high blood pressure. It has the capacity to lower the blood pressure because of its strong antioxidant effect. It has an anti-aging effect. Aloe vera generally is better dried. You cut it and dry. By so doing, the aloin effect, alocin, and some other related effects are highly subdued. Overall, it has immune stimulating and potentials for increasing CD4 count because of their immune boosting properties. This is washed properly and cut into pieces and fully exposed to very bright sunlight, which dries it, and by the time it is fully dried and mixed with corn, that neutralizes the greater side effects as a result of aloin, which I said earlier. The toxicity and the effect of the aloin. In animal experiment, the aloin was found to cause cancer of the colon. So one has to be very, very careful. If something can cause cancer of the colon, you need to work with experts. Even having explained to you how to use it in this program, there's a need to work with experts. It's of no use going to sit down on your own trying to perfect the use of these products if cancer can be involved. It is really dangerous. There are over 500 species which have not been fully studied. So you will not know which one has such dangerous effects. Those people who are producing them have studied them, and they know the risks that are involved, and they have taken care of those risks. So working on their product, using their product, will not be any issues. Aloe vera gel has been compared in terms of therapeutic activity to the best known burnt agent in the world, Damazine cream, and it was found to have equal or better activities against burn. So either when used as raw, direct gel, or in combination with Vaseline.
That does it of this episode of Health Options. A quick reminder that you can watch the upload of these and other episodes of the program on our YouTube channel. Email us for your comments and contributions at healthoptions@nta.gov.ng. My name is Rabi Abdullah. Thanks for watching. Hope to see you again.